Dr. Gray is holding a heart in her hand. What happened? Hey guys, Real Doctor Jin here, board certified internal medicine doctor. I'm so glad that a lot of people like my video on Gray's anatomy. I need you to give thumbs up for this video as well, and it can reach to more people. With more people joining us, we will have more fun. Today we are going to watch Gray's Anatomy episode 5. Dr. Gray is holding a heart in her hand. What happened? Let's take a look.
Sign everything over to you.
Me?
Dr. Gray seems not listening at all. Is she too tired?
It really does suck. Look, I haven't slept in 48 hours. I'm getting my first shot at heart surgery this morning.
No sleeping for 48 hours. That's a little bit crazy. I've never had that experience in my residency. And she's going to do the surgery. Oops.
Adults have to be places and do things and earn a
They are
living
doing
and
heart
pay
surgery.
the rent. And if you're training to be a surgeon, holding a human heart in your hands? Hello, talk about responsibility.
Oh, Dr. Gray sleepy. Oh, Dr. Gray holding the heart and fell asleep.
Start now. Very gently. Alright. Let's warm her up.
So Dr. Burke is doing the bypass surgery with Dr. Gray. That's a very successful surgery nowadays. In what situation you need bypass surgery? Usually when your big vessel of the heart get blocked, and then you need another vessel from other part of the body to replace it. That we call bypass surgery. And when you're doing the surgery for the bypass, you can imagine if the heart is beating, it will be very, very difficult to do the stitches. So they need stop the heart, do the stitches, and then, like the car, jump start the heart.
Temperature?
She's at 96 and rising.
She should be doing this on her own.
Oh, seems the heart is not beating.
That's her forward. Continue following.
What to do?
Come on, Mrs. Patterson.
Paddle.
So paddles, I believe they are going to use the defibrillation to jump start the heart, like jump start the car.
Sets are below 90.
Charge.
What you see here is open chest defibrillation. It is different from the one we usually see at daily life. And the energy for this one is much lower than the one we usually use. Usually we give 100 joules, 200 joules, but this one usually 10 joules, 20 joules.
10 joules. Clear. Mrs. Patterson. Give me 20.
Charge.
There. Yeah.
The heart beating comes back. Good job, Dr. Burke.
Reluctant heart. All right. Let's close. Keep an eye on it. Good work, everyone.
The scariest part about responsibility, when you screw up.
Uh-oh, Dr. Gray's fingernail cut through the glove. Will that cut the heart? Being a surgeon, we can't have long fingernail, but our hand is very beautiful because we save patients.
I think maybe I did something to the heart when I was holding it.
Oh, seems something will happen.
My fingernail popped the glove, cut straight through. George, what if I punctured Mrs. Patterson's heart?
If you had punctured it, you would have known when they reperfused. They got her heart beating. The woman's okay.
Yeah.
So I shouldn't tell Burke.
Well, tell him what? Nothing happened. The woman's okay, right?
She's okay.
Yeah, this is a very difficult situation for the interns, for the doctors in training, because we are not sure what we need to do, what is supposed to be right.
Hi, Mr. Patterson.
Hi.
Hemodynamics stable?
Hemodynamic state around 80, cardiac output at 5.
Clinically, usually we use mean artificial pressure to replace the systolic pressure and diastolic pressure because that's easier for us to monitor. And the normal range is 70 to 100. Seems patient is okay. Cardiac output, usually it measures like how much blood you pumping out of your heart. And normal range should be 4 to 8. Patient's 5, seems okay.
That's good, Dr. Gray,
That's fine, Mr. Patterson.
but it's not good.
Well, heart surgery takes a lot out of the patient, but we're monitoring your wife very carefully, and she should be fine. Oh. What happened?
I started having some swelling over her sternum, and then the blood just started gushing.
So the patient has the bleeding from the wound. What happened? Is the heart bleeding?
Well, last count.
PT, PTT, INR, platelet counts were all stable. Even her H&H were stable.
Based on the labs, patient's coagulopathy is normal range. That means patient's blood is able to stop bleeding by itself. But why patient is bleeding? Look at the heart rate. It's more than 100. It means patient has tachycardia. Whenever a patient is bleeding a lot, the heart rate always go up, beating faster to compensate, to pumping more blood to the different organs.
What the hell went wrong? Let's move.
Hold on. I popped a glove.
What?
In surgery, when I was holding it, I popped a glove with my fingernail. I think I may have nicked her heart.
I totally understand Dr. Gray. As an intern or resident, we do make a lot of mistakes. And sometimes that mistake is in our mind all the time, and we blame ourselves all day long.
People.
Oh, this is not occasion for Dr. Gray to talk about that, because sometimes our guilty will become a misleading for the family member.
Over here. There. Look at the wall puncture. It's a hell of a lot more than a fingernail. A ventricular wall's for weak.
It seems patient's heart muscle is weak and thin.
I just had a conversation with Mr. Patterson. I want copies of his wife's chart in my office by 5. Tomorrow morning, the two of you are going to meet with me and legal, and you better damn well be able to explain what happened here.
And talk to the husband. Review the history. Apologize profusely. Your ass is on the line here, Dr. Gray.
Uh-oh. Will Dr. Gray be blamed for this? As an intern, we are very stressful because any mistakes can make us go to probation or directly be fired. As an intern, we're always walking on the ice. That's why internship is very stressful.
Mr. Patterson, I know that you're frustrated and angry, but we need some more information about your wife.
You know, she was in the best shape of her life. You ask the cardiologist. She had lost 100 pounds. Don't you dare try to hang this on her.
Oh, she lost 100 pounds. That's a good job, but you need to make sure it's water, fat, or muscle loss.
She still weighs 200 pounds, which is why no one even noticed it. But with that kind of a weight drop, it doesn't matter how much you weigh. Technically, you're anorexic.
So along with all that fat, she was losing muscle, heart muscle.
You've left yourself and the hospital open to a tremendous amount of liability.
Oh, no, not if the patient's weight loss caused a problem.
I'm sorry, I have no choice here.
I've spoken to the husband, and I believe that as long as his wife remains stable...
I can't take your beliefs to the bank, Dr. Burke. Dr. Gray made a huge error.
And she reported it.
Too late, and in front of the patient's husband.
But she reported it. She spoke up.
The liability of a doctor is a huge source of stress. I heard some OBGYN doctor, they pay $100,000 for the malpractice insurance every year. Whenever a doctor makes mistakes, they will blame themselves the whole day, whole night, sometimes the whole week. At the same time, they also worried about a lawsuit.
5 years ago, as a CT fellow, I had a nagging feeling that I didn't check the body cavity of a lung patient closely enough before I closed. The patient seemed fine post-op, and I was in a hurry. And yesterday, you and Dr. Bailey pulled the towel out from under that patient's lung. Why didn't I report it at an appropriate time? Maybe because I was afraid that I would be called into a meeting where some hospital lawyer's fear of liability could end my career. Even great doctors make mistakes, and when we do, we've got to have a chance to be able to speak up without fear of retribution, or everyone suffers. Dr. Gray spoke up.
Dr. Burke is a great doctor now, but when he was in the fellow, he also made mistakes. He left the towel in patient's chest.
Responsibility. It really does suck.
Meredith, you okay?
Yeah, 1 month probation.
Good.
Dr. Gray was put on 1 month's probation. That's not too bad. Sometimes interns will be asked to repeat a whole year residency because of mistakes or poor performance.
That's good.
Yeah, Burke saved my ass in there. Unfortunately, once you get past the age of braces and training bras, responsibility doesn't go away. Or we suffer the consequences. I mean, the shoes, the sex, with no parents anywhere telling you what to do. That's pretty damn good.
Okay, this is the end of the episode 5. We talked a lot about the responsibilities, adult responsibilities, doctor's responsibilities. As an intern, the pressure and the responsibility can be very hard to handle. And if it is not very well or poorly managed, it can carry very severe consequence for the physician. That's why doctors has a higher divorce rate, substance abuse rate, and suicide rate compared to other professions. I love this episode. It very well shows the fear of the intern. If you like watching this video, please give a thumbs up and click the subscribe. By watching this video, I really hope you can understand the doctors more. I will find more great stories from Grey's Anatomy and share with you, watch together with you. But if you think some other story is more interesting, please leave a comment. We will watch together. And see you next Tuesday. Be happy and stay safe.